In this topic, we're going to learn about the Enterobacteriaceae. For this type of bacteria, it generally infects humans' digestive system. The general characteristic of Enterobacteriaceae, all of them they are gram-negative rock-shaped bacteria, and they are facultative anaerobe, which means they can grow in the environment. They prefer to grow in the environment which is lacking oxygen. However, they can also grow in the environment with oxygen. They can ferment glucose to acid with or without gas. They can reduce nitrate to nitric. When you test them with oxidase, they are oxidase negative. The growth is not enhanced by presence of sodium chloride. Most of them they are motile. However, only a few of them are immotile, like Klebsiella and Shigella. There are over 31 genera with more than 100 species, and however, only a few of them are pathogenic to human, which means the rest it may be non-pathogenic or just a normal flora. And they have produced different metabolic profile, namely sugar fermentation, and they are able to produce H2S production. They are differentiated into the lactose fermenter and non-lactose fermenter. What is the meaning of lactose fermenter and non-lactose fermenter? If you grow the Enterobacteriaceae in the McConkey agar, the lactose fermenter bacteria, they are able to ferment the lactose, which means they can metabolize the lactose in the medium and produce acid. When they produce acid, this changes the culture of the McConkey medium into pink color. So those producing pink color colony, they are lactose fermentation. Example lactose fermenter are E. coli and Klebsiella. While for those non-lactose fermenter, they are unable to metabolize the lactose in the McConkey medium, so they will just produce a normal colorless colony. It's important for you to remember the example of lactose fermenter and non-lactose fermenter bacteria. These are the family of Enterobacteriaceae. However, only a few of them are pathogenic to human. The bacteria Enteroceae, they can be divided into primary pathogen and opportunistic pathogen. Primary pathogen mean that they are pathogenic to human when they are present in the human system, the digestive system. However, some of them they are opportunistic pathogen, which mean that in a normal scenario, for example like E. coli, they are normal flora in the digestive system. However, in certain scenario when they are present in the place that they are not belong to, or in the patient with this immunocompromised, they may become pathogenic. So this is called opportunistic pathogen. These are the virulent factor of Enterobacteriaceae with the antigen, the capsular antigen, or we can call it as K antigen, more than 100 types, and O antigen, or we call lipopolysaccharide antigen, more than 150 types, with flagella antigen, or we call H antigen, more than 50 types, and also pili. Pili can also call as fimbria, or also toxin. These are the virulent factor of all the Enterobacteriaceae. This picture showing the three types of antigen, which is the H antigen, the O antigen, and also the K antigen. Besides that, the pili also been shown in the figure. For the pili, it can be classified into the type 1 and type 2 pili. The type 1 pili, also known as mannose-sensitive pili. What is the meaning of mannose-sensitive? Actually, this is classified via laboratory experiment. First of all, mannose is a type of sugar present in as a product of metabolic activity from the human cell. Now, the type 1 pili, or we call it as mannose-sensitive pili, we identify them through an experiment. Imagine this is a human epithelial tissue. When you apply mannose into the human epithelial tissue, this mannose is a type of sugar produced as a metabolic activity from human metabolism. This mannose will bind to the cilia, the receptor of the host cell. Once the mannose binds to the receptor of the host cell, this bacteria is unable to bind. This meaning that the bacteria share the same binding site as the mannose. So adding the presence of mannose inhibit the bacteria from binding to the host cell. While type 2 pili, they are mannose resistant. So in the experiment, I added mannose to the host cell. The mannose will bind to the receptor on the host cell, followed by binding of bacteria. You may be noticed that the bacteria bind to different sites from the mannose, so which means this mannose is unable to inhibit attachment binding of this bacteria. So this is called type 2 or mannose resistant pili. Besides the pili, the toxin is also the virulent factor. The protein exotoxin, the role is to damage the membrane, inhibit protein synthesis in the host cell, altering the metabolic pathway in the host cell that leading to example like diarrhea, and they may be leading to cell death or any physiological changes in the cell. Now, let's look at one of the Enterobacteriaceae bacteria, which is E. coli. E. coli is the normal flora in human. However, in immunocompromised patient or in normal healthy patient, but when the E. coli present in the place where it not belong to, for example, like female urethra, then it may be pathogenic. So this E. coli is the normal flora. However, when it's present in certain area, it can be a pathogenic. So the disease just that associated with E. coli are diarrhea, urinary tract infection, meningitis, and sometimes it may cause septicemia, wound infection, abscess, and infection of various tissue as well. This is a microscopic of E. coli. They are gram-negative bacteria in rock shape, and their body are covered with a lot of flagella. E. coli, actually we can classify them into 5 types based on the pattern, the pathogenic, the mechanism, how they can cause diarrhea in the host. So we can classify them either into the enterotoxigenic, enteropathogenic, enteroaggregative, enteroinvasive, and enterohemorrhagic. Remember that this type of classification is we classify them based on the mechanism how they cause pathogenic in the host cell. In your note, there's a detailed description of each type. This is just for your additional understanding. What you need to know is only knowing that E. coli can be classified into these 5 types. This is enough for you. How can we diagnose E. coli? It can be easily diagnosed by culturing them on the McConkey media, and then because they are lactose fermentation, so they'll produce pink colony in the McConkey medium. Other than this, we can also conduct spatial tests by using the ELISA or ELISA antigen antibody reaction to differentiate different type of this E. coli. However, this type of spatial test is rarely to be conducted in normal medical laboratory. To treat E. coli, since they are leading to diarrhea, so it's important to treat via this oral rehydration salt. And sometimes, in some severity, the patient may need to have transfusion and hemodialysis. Some of the E. coli, they may develop antibiotic resistance. So, the antimicrobial drug therapy may be contraindicated for the non-life-threatening infection. The next species of Enterobacteriaceae is Salmonella. Salmonella is strictly pathogenic to human. First of all, these Salmonella, they are motile. However, they are non-lactose fermentation, which means they are producing colorless colony on McConkey agar. Salmonella, for the classification, previously we are using the biochemical reaction to classify them. However, now all species of Salmonella are grouped under one single species called Salmonella enterica, and then under Salmonella enterica, we further classify them into different serotypes. So, one of the commonly heard Salmonella bacteria is Salmonella typhi. So, to be proper, this Salmonella typhi, in proper term, we should address them as Salmonella enterica serotype typhi. However, commonly we still call them as Salmonella typhi. The diseases that caused by Salmonella are typhoid fever, enterocolitis, and bacteremia. However, among them, the most common one is typhoid fever and also enterocolitis. Let's look at the pathogenesis of enterocolitis. Enterocolitis meaning inflammation at the wall of intestinal. So first of all, the emission is through the oral transmission. Normally is through the fecal-oral route. So the patient is consuming the bacteria, and then to cause the infectious dose, you need to have more than 1,000 Salmonella organism. From there, this Salmonella will infect the M cell. M cell is one type of the epithelial cell in the intestinal. From there, they'll multiply at the submucosa region. Then they'll cause apoptosis of the macrophage, followed by accumulation of CMP. The accumulation of CMP will leading to the fluid and also ion secretion into the intestinal lumen. Then this will leading to the inflammation at the intestinal lumen, and the toxin also inhibit protein synthesis in the epithelial tissue of this intestine. And then later on, this bacteria is able to be cleared by phagocytosis process. So the enterocolitis, the infection is only occur at this epithelial tissue of intestine. However, in the other types of disease which is associated to this Salmonella are typhoid fever. This typhoid fever may be life-threatening. First of all, in terms of pathogenesis, it is similar. Start with the ingestion of the bacteria. Once it's ingested into the intestinal, you will maybe found that this bacteria will enter into the bloodstream. In previously, the enterocolitis, the bacteria did not enter into the bloodstream. Now, in the typhoid fever, once the bacteria enter into the bloodstream, it may be carried to other organs. From there, some of the bacteria may be excreted through stool. From here, it is the one factor that leading to fecal-oral route. When the bacteria is carried to other organs, it may cause other symptoms happen in like heart and also brain and other part in the body. Then the patient may develop high fever, and this may be leading to enlargement of the spleen and also liver. So, however, today we are having antibiotic. The treatment with antibiotic is able to really reduce the mortality rate caused by Salmonella. For the laboratory diagnosis, normally we are using the urine or stool or blood to diagnose the presence of this bacteria. So these are the collection. How can we confirm? How can we test them? For using the normal normal laboratory culture, we are using the McConkey agar. And however, we also have other biochemical tests to confirm this infection. For the blood culture, normally the is positive alone with 50 to 70% of the cases. Sometimes we need to do multiple blood culture to increase the sensitivity. As you can see in this figure, this graph here showing the isolation organism from various samples in different timing. So at here is showing the x-axis is showing the weeks after the onset of fever. So you may be noticed that the percentage of positive, if you are collecting the blood sample, you may be noticed that the sensitivity by detecting Salmonella using blood is decreasing in weeks after the onset of fever, and urine is increasing later. However, to get highest sensitivity result, the best is by testing the stool, because this bacteria may present in stool for longer period of time. So the gold standard, one of the gold standard to detect this Salmonella infection is by detecting the stool. For the serological diagnosis, we can use a vital test to detect the presence of antigen. However, today we have also other new tests to be employed, used in the laboratory to detect Salmonella. One of the tests is called Typhi dot. The Typhi dot is the test kit developed by Malaysian scientists. For the prevention, for the vaccination, currently we have oral vaccine. Okay, so for those people they intended to travel to overseas which have lower hygiene, so it's recommended for them to take the oral vaccine. The last species of Enterobacteriaceae is Shigella. However, Shigella, the disease called dysentery. However, you may be noticed that this Shigella, they are self-limiting disease. What is the meaning of self-limiting disease? Which means that the patient, once they infected with Shigella, they will develop the symptom. However, this symptom may be automatically disappear after a few days. Then the patient may recover to normal, maybe without any medication. So for Shigella infection is a self-limiting disease. It will disappear automatically in some scenario. However, not all, but generally the patient can recover back to normal, and the infection area normally just limited to the digestive system. It won't spread, rarely go into the bloodstream. So the disease caused by Shigella we call dysentery. These Shigella, they are non-motile and they are non-lactose fermenting, which means they will form colorless colony on McConkey agar. These are the classification of Shigella. So these are the virulent factor of Shigella. Out of the virulent factor, the one that commonly we discuss about is the Shiga toxin. So for this Shiga toxin, it consists of two subunits, A and B subunit. Once the Shiga toxin is released, it will stimulate the fluid secretion, and then this fluid secretion may cause the cell death, and then the epithelial cell may be undergo apoptosis process. Later on, you may look into the lecture of Vibrio. In the Vibrio, I did explain detail how the toxin causes the stimulate the fluid secretion from the bloodstream into the intestinal lumen. In terms of pathogenesis, first of all, this Shigella is enter into the human through the oral. So normally the infectious dose is on the order of 1,000 organisms and above. Once the Shigella bacteria enter into the digestive system, first it will infect on the M cell, or we call them as a mucosa epithelial cell. In the mucosa epithelial cell, they will be phagocytosed by the macrophage, and then later on they will escape and enter into the cytoplasm of the epithelial cell, and then from there they will multiply and pass to the adjacent cell. Once they present in the epithelial cell of this intestinal system, they may be leading to the necrosis of the cell, and then the cell may start to form ulcer and to have formation of scar tissue. In terms of laboratory diagnosis, we can diagnose them by examining the stool, and then to culture them, grow them in a McConkey agar to identify, and then we can further confirm by using specific anti-sera. For treatment, normally we can just treat the patient using by having fluid replacement and also giving antibiotic. The control and prevention is similar to the Salmonella, that is having a hygiene control.